Early signs and symptoms of diabetes. Type 2 diabetes can develop gradually, with very minor symptoms in the early stages. As a result, many people may be unaware that they suffer from this illness. According to the Centers for Disease Control and Prevention, diabetes affects 30.3 million individuals in the United States. Type 2 diabetes causes an individual's blood sugar levels to become abnormally high. Recognizing the early signs and symptoms of this chronic illness can help a person receive treatment sooner, lowering the chance of serious consequences. The following are some of the early indications and symptoms of type 2 diabetes. 1. Frequent urination. When blood sugar levels are high, the kidneys attempt to filter the extra sugar out of the bloodstream. This might cause a person to need to urinate more often, especially at night. 2. Increased thirst. The frequent urine required to eliminate extra sugar from the bloodstream might cause the body to lose more water. This might lead to dehydration and a person feeling thirstier than normal over time. 3. Constantly being hungry. Constant hunger or thirst are early warning indicators of type 2 diabetes. Diabetes patients frequently do not obtain enough energy from their diet. Food is broken down by the digestive system into glucose, a simple sugar that the body utilizes for energy. With diabetics, not enough glucose is transported from the circulation to the body's cells. As a result, persons with type 2 diabetes typically feel hungry all of the time, no matter how recently they ate. 4. Feeling exhausted. Type 2 diabetes can affect a person's energy levels, making them feel sluggish and exhausted. This fatigue is caused by a lack of sugar flowing from the circulation into the body's cells. 5. Blurry vision. A high sugar level in the blood can damage the microscopic blood vessels in the eyes, resulting in hazy vision. The fuzzy vision might affect one or both eyes, and it can come and go. If a person with diabetes does not receive treatment, the damage to these blood vessels might worsen, leading to irreversible visual loss. 6. Cuts and wounds heal slowly. High blood sugar levels can harm the body's neurons and blood vessels, causing blood circulation problems. As a result, even minor cuts and wounds can take weeks or months to recover. Chance of infection is also increased when wounds heal slowly. 7. Hand and foot tingling, numbness, or pain. High blood sugar levels can impair circulation and harm the body's nerves. This can cause discomfort, tingling, or numbness in the hands and feet in persons who have type 2 diabetes. This neuropathy can worsen over time and lead to more serious consequences. 8. Dark skin patches. Patches of dark skin in the creases of the neck, armpit, or groin might also indicate a high diabetes risk. These patches may have a velvety feel to them. Acanthosis nigricans is the name for this skin disorder. 9. Itching and yeast infections. Excess sugar in the blood and urine feeds yeast. Yeast infections are more common in warm, moist skin regions including the mouth, genital areas, and armpits. The afflicted regions are often itchy, but patients may also report burning, redness, and pain. Be sure to like, subscribe, and hit the notification bell to get more videos like this one.